is Doug Brunk for Global Medical News Network, reporting from the annual meeting of the American Academy of Allergy, Asthma, and Immunology in San Francisco. During a poster session, Dr. Edward Hugh presented findings from a study which set out to examine asthma control classification based solely on lung function in asthmatic children enrolled in a disease management program. Dr. Hugh, can you tell us what you set out to do in this study?
So in this study, performed at University of Southern California, I wanted to take a look at the which components of the 2007 EPR3 guidelines for asthma control, which components are best able to identify which patients have uncontrolled and controlled asthma. Specifically, I wanted to look at the utility of lung function testing in pediatric patients to see how likely and how able they were able to identify which patients have well-controlled asthma and which patients have poorly controlled asthma.
What were some of your key findings?
So using lung function testing alone, approximately 1/5 or 21% of the patients were uncontrolled or very poorly controlled asthma. When we included all components of the guidelines, lung function testing as well as all the other parameters of impairment and risk, an additional 22% were found to be uncontrolled. And so really the conclusion of the study is that in order to best assess asthma control, all components of the guidelines, impairment and risk, including lung function testing, should be used in order to identify patients with asthma control.